Welcome to Focus on Seniors, a television show sponsored by Helping Seniors of Brevard County, Florida. The show is designed to make you aware of senior issues, needs, and resources available to help us age in place and with dignity. This show will help you as you develop your own aging and care plan.
I'm Joe Steckler, and welcome to Focus on Seniors, the television arm of Helping Seniors of Brevard County, a show designed to provide you with information how to develop your own aging and care plans. Our topic today is double vision, and with me in the studio is Dr. Michael Mendese of the Eye Institute. And I want you to pay close attention, folks, today, because I've done over 270 television shows, and this is the very first one I've really done on eye care. It's a topic that we tend to neglect both in education of the general public, my opinion, and we fail to provide adequate information through the media resources that we have available on what we can do to improve our own chances of maintaining our vision correctly. Do you agree with me, Dr. Mandese?
Absolutely.
I figured you had to. You had to. But no, welcome to the show, Doctor. I was very honest. We don't give enough attention to the care of our eyes. And I would like just for you to just give our viewers just a short overview of your own background, how you got involved in eye care.
I was born and raised here in Merritt Island, here in this county. My brother was an optician at the time, and he kind of influenced me into going into the area of eye care. And I knew I wanted to be a doctor of some sort, so it kind of flowed very well. I furthered my studies and undergraduate studies at University of Florida, so go Gators. But then
you had to get that in. They're doing well, too.
Of course, absolutely. Well, then I was fortunate enough to get into optometry school at Nova Southeastern University. Did 4 years of my doctorate there, all the while getting some training at Bascom Palmer Eye Institute. I did a residency in ocular disease that included work with a fellowship-trained neuro-ophthalmologist in order to kind of set me straight into the double vision area, which is my special area of interest.
Okay. What is double vision?
Well, it can be defined in many different ways because, interestingly, patients come in complaining of double vision or not. Sometimes they actually say, gosh, my vision is blurry, not realizing that it's just double enough to not have a sharp edge on what they're seeing, but their eyes are not working perfectly together. So they don't realize they have double vision. So it can be defined in a couple of different ways.
Now if you're bordering on double vision, would that be a cause for wearing glasses?
Yeah, sometimes. Sometimes, absolutely. And patients, like I said, they can get new glasses and not be corrected for the double vision specifically because they don't know that they're having that, or if they don't have the special testing for it, then they end up still not satisfied with their correction because they don't realize that that's what they have, unless specific sets of questions are asked or specific types of testing are done. Okay.
I'm an average person. I wear glasses, but I started wearing glasses because I couldn't read well. Mm-hmm. And I had the half glasses. And I was sitting on my nose all the time. My wife didn't like those. And a lot of other people didn't like them either. And so then I went to full glasses, bifocals, because I had problems seeing further down the road as well as seeing up close. But a person like me, we go see an optometrist to get our glasses, right?
That is the traditional sense. Yes. We
just go into the store and buy glasses. But does a doctor, when they look at your eyes just to see glasses, do they look for eye disease? They look for other things? Because in order to get to a person like you and the other doctors in the Eye Institute, you just don't go out and fit people for glasses.
Correct.
You operate, you treat diseases.
Correct. We actually examine the eyes for diseases, and it's a very focused type of evaluation because we want to know what kind of problem the patient's having, and then you go in that direction with it. So basically, when the patient is in the optometrist's office, all optometrists are licensed to do all of that. It's the ones who choose to actually go a little bit further and manage patients medically, like myself, that are working in that capacity, for sure.
Folks, I asked Dr. Mandese a question prior to going on to shooting the show, and his wife, Leanne, is a optometrist. And when I was reading his background, it said optometric in there. And I wondered, is there a connection between the two? And Dr. Mandese explained that both his wife and himself have really essentially received the same training.
We did.
But you've gone into the treatment of the disease part where Leanne does more of helping people see.
Actually, she diagnoses and treats disease also. She has a comprehensive set of equipment, very latest and greatest in technology. She has laser scanning. She's got a visual evoked potential, a visual field machine. She has all kinds of different things in her office too. So she's also a residency trained optometrist, or optometric physician. These are interchangeable terms. So in any case,
you can see from just a couple of the questions I've asked that probably most of the people watching this show would be as misinformed as I am about what eye doctors really do.
Right.
Yeah, and it's a field that we need to know more about. And then we're going to do that. We're going to have the Doctors from the Eye Institute are going to do a show on glaucoma. We're going to do a show on cataracts. We're going to do a show on macular degeneration, and that's extremely important.
Absolutely.
But let's talk about your specialty, double vision. I know you've got a what I call a training aid here, and my question was about asking you to explain the normal working of the eye.
Okay.
You do that with that, as I think it's very effective, and I watched you talk about it before the show.
Well, in order for the eye to see, light has to enter the cornea, which is the front clear window of the eye, goes through the cornea and actually through the lens. The lens is where you get your cataract. And it ends up trying to be focused on the retina. It goes from the retina to the optic nerve and then travels to the back of the brain. Well, both of the eyes have to work together. If they don't work in exactly the same manner and are focused on the same exact spot, then the patient may have a splitting of their vision. All right? What that means is, and you can see these little red things on the outside of my model, these are the muscles that are on the outside of the eye that turn the eye. So basically one of them has to pull, the other one has to relax out in order for the eye to turn. So that's one way you can get double vision. The other way you can get double vision is if you have a problem with the cornea, or if you have a problem with the lens on the inside. Cataracts can cause double vision also. So if a patient comes in and states that they have double vision, that's not good enough to give me a direction to go in with the examination. Because I need to know, are they seeing double vision out of one eye? Meaning, I ask them, have you covered one eye to see if you still have double vision with one eye open, or is it with both eyes together? Because that helps to distinguish, is it a muscle or a neurological problem, or is it a medium opacity problem, meaning if it's on the cornea or on the lens, when light hits that opacity, light tends to bend around opacities, which would cause the patient to have more than one image in that one eye.
So are you talking about, before we went on the show, you mentioned something about the brain.
Right.
And explain to our viewers what you were talking with the crew here in the studio about the part the brain plays on what you're seeing there, because I thought that was very interesting.
Okay, what I was referring to was, you're not born seeing 20/20. Your brain has to learn to see 20/20. So when you're born, you basically can see shapes. You have decent vision. You can recognize your mother, and that's really what you're supposed to do. Over the next 6 months, though, your brain develops, and it also helps to develop the different centers in the brain to make the eyes work together. So a lazy eye is basically an eye that does not develop properly. Either it's turned and the brain shuts it off because it's turned, okay, because the brain doesn't like to see double, or if the eye is just too blurry, the brain will shut it off also. So that eye it's not the eyeball that doesn't develop, it's the brain part that is stimulated by the eye that doesn't develop. So if one of the parts of the brain that doesn't develop goes with one eye, then you don't develop 3D vision or binocular vision. So it's all a developmental issue when you're first born and going from there. In addition to that, similar stuff happens after a stroke. You know, if your brain is damaged on a stroke, you can lose function of one or both eyes in different manners. Well, you know, just like you can develop and learn to see at your first part of life, you can rehabilitate the brain in the same vein in order to get some of that function back.
Okay, bring your model back now.
Yes.
I have a question. I'm going to test our doctor's knowledge here. All right, take that thing off the side because I want to talk about when the light goes through here. And okay, the light comes through. I have cataracts.
Yes.
But I have a condition that they were worried about taking the cataracts off with a laser, such that it would wash off the retina or the part of my cornea. What is that called?
Are you talking about the cornea issue?
Yeah.
Okay. Well,
what they're worried about is if they do take my cataracts off, there's a great chance that more of the coating of the back of the eye will wash off. Okay.
I think you're referring to the back of the cornea. Really.
Back of the cornea, yes.
When we go in and do a surgical procedure to remove the cataract, a particular amount of energy is delivered inside the eye.
Right.
That energy is converted to heat inside the eye. So you want to use as little bit of energy as possible to break up that lens. And when you break it up, it becomes a liquid lens. Then you vacuum out the liquid lens, right? Well, the process that you're breaking it up is called phacoemulsification. All right, that's done with ultrasound. The deal is, if you use too much energy, or if you have to use a ton of energy because the cataract's really thick, then you can actually damage the inside layer of the cornea, which really acts as a pump. All of the cells in the inside layer pump fluid out of the cornea. So there's a delicate balance of fluid in the cornea. If you can't pump fluid out, then the cornea will swell and become cloudy itself, thereby needing a partial corneal transplant called DSEC. That's what Dr. Shoemake and Dr. Palmer do.
He's going to talk about that?
He will talk about cataract surgery. He may get into some of that, especially if you ask him. He's very well versed.
Because one of your doctors, Dr. Palmer, I had a little, like a cyst on my eye, and she took that off. And one of her specialties, I think, is cornea replacement.
That is true. Dr. Palmer and Dr. Shoemake are both corneal specialists.
So, when I can no longer read with that strong light focused on my book at night, then I'm going to have, but I'm almost at the point, folks, where I know that I have to do this. But I've asked several doctors, and most of them have advised me to wait as long as I can. But I'm beginning to think now that sometimes it might be smarter to go ahead and do things if you have the right kind of doctor that knows what they're doing. And I'll tell you, when Dr. Palmer, it's like, she used an ice cream scoop to get that little, she just gave me a little, the only thing I felt was a little pinprick where she gave me the shot to dead it, and the next thing I knew, she had that thing out there, and I was out of the chair. And
it's amazing how easy that stuff is, isn't it?
Well,
for the patient.
Yeah. Well, and that's what we hope to show with all the shows that we're going to do on glaucoma, macular degeneration, because we're not living in the Stone Age now. Mm-hmm. We've got technology has advanced along in care of the eyes, so there's so much more we can do now that we couldn't do before. Mm-hmm. And that's what's important. Okay, how do you treat double vision? What can you do?
Well, once I've examined the patient and know what it's coming, where the double vision is really coming from. Yeah, I'm going to go ahead and put it away. Once I've examined the patient and I know where the double vision is coming from, whether or not it's a medium opacity from the cornea or a cataract, or if it's actually a muscle problem or a nerve that's causing the muscle problem, then you want to talk about getting rid of the actual cause of the issue first. Okay? So if there's a brain tumor that caused the muscle to not work, or if it is a stroke, or if it's basically thyroid eye disease, or if a patient's a diabetic. So there's a whole host of different reasons for a patient to develop double vision where the two eyes don't see together. So first we need to find out why. Okay, and the first course of action then is to go through examinations in the office, and then if need be, we'll have additional examinations done outside the office, including but not limited to MRIs and magnetic resonance angiograms or other types of angiograms of the brain. You can do an MRI of the orbit, which is around the eye itself, to look for inflamed muscles or different types of...
I think, so what you're saying is, you don't just look at the eye to see what the problem is. The brain could cause it. Other diseases
true.
in the body could. It's just like many people don't realize that sores in the mouth can be one of the greatest transmitters of disease to the heart and other parts of the body. I think we're starting to learn more about the connectivity between the different parts of the body, and we can't rule out anything, can we, doctor?
No, you can't. Not until you actually go through and you kind of do your checklist, like a pilot does their checklist to make sure that everything's taken care of properly. That's pretty much how we go down the list, and depending on the actual cause of the problem, that'll take you in the direction of this particular checklist versus a different one.
Can you think? Let's do a case study. Can you think about let's say pick a cause and a treatment? How you do that? Just pick one example.
Okay. Say someone comes in with a simple complaint of I see double, all right? And I've done everything to rule out problems. I've done everything to rule out the brain tumors and strokes and everything else, right? Well, the next step is, okay, is it going to go away on its own? Sometimes they do. If it's just lack of blood flow to one of the nerves that supplies that muscle, okay, that nerve can actually grow back. So sometimes it's best just to do nothing. And then other times, if the problem persists and it doesn't go away on its own, then we have a decision to make. Can we actually prescribe them a pair of glasses that will give them a focus of just one vision?
You can do that?
Yes. Prism glasses can actually straighten the vision out very well in most cases.
So it corrects for the brain.
It does. What it does is it moves the image to where the eye is. So if one eye is higher than the other, it'll move that image higher so that now the eyes, even though they're looking in a different direction, you have the images in a different spot for the eyes to actually kind of tricks the brain to think you're seeing the same thing. So if you can't correct it with glasses, then there's actually a surgical option. And the surgical option is to do a surgery on the muscles and shorten or lengthen them in order to get the eyes to line up properly. And as I alluded to before, some patients are born with a lazy eye and the eye turns. Well, those patients go through muscle surgery when they're young sometimes, but patients in the aging population also go through muscle surgery at the same time.
Do you do that type of thing?
I do not.
You do not?
I do not. I do everything up to that point.
Okay. Is one thing we now have not even thought about, since this is a show called Focus on Seniors, how common do you find double vision in seniors?
Well, since this is what I do almost all day, every day, it's pretty common to me. I see quite a bit of it. I think patients don't realize that they really have a problem. Some people just go through life dealing with it. Oh, yeah, I'm just getting old, and what do you expect? I'm 70 or 80 years old, and they think that's it. That's how life should be, but it really isn't. You've got to make sure that you don't have a true problem causing your issue, number one. And number two, you don't have to go through life having doubling of your vision, whether it be up close or in the distance, or I have patients that tell me they have it when they're driving, which is pretty scary.
Education.
And you're absolutely right.
Question, can thyroid disease cause double vision?
Absolutely. Thyroid disease, and it's interesting because someone can have had thyroid disease for many years with a very normal thyroid level and then end up with thyroid eye disease later in life, which what thyroid eye disease is inflammation of the muscles and the orbit around the eye. So if you get inflammation of the muscles, of course, it'll shorten the muscle and not allow it to let the eye move freely. So it will tether the eye, not allowing it to go in the direction. Usually the bottom muscle of the eye, called the inferior rectus, is the most common one that's affected.
When we talk about the optic nerve and we talk about dry eyes and how much does lubrication of the eyes have, or does that have an effect in causing double vision?
Absolutely. If you have dryness to the point where it bothers you, okay, the likelihood is you've noticed that after reading for 5 or 10 minutes, the vision starts to get blurry because the dryness gets worse. You're not blinking as much when you read, or computer work similarly. So those dry spots on the cornea can deflect the light, which can make you have multiple images, sometimes 2 or 3 images. In one eye, though, and that's the differentiating factor, whether or not it's a corneal or an opacity problem versus a muscle or a neurological issue.
Okay, now let's think about double vision for a second. We're inside a house, we move outside.
Right.
We got the direct sunlight. Why is it that we see better in the sunlight than we do in a house?
Well,
Focus?
There's a lot to do with the natural light source.
Okay.
Because you've got all of the colors of the spectrum that are illuminating what you're looking at. You get better contrast when that happens.
Okay.
When you eliminate some of those colors in the spectrum from fluorescent lighting, or even now that some of these LED lights don't give you all of the different colors, you end up getting a different contrast and thereby not allowing yourself to see quite as well.
I mentioned it before, but I asked about, in the case of temporary double vision, how do you treat that?
Well,
you made a comment about...
in the testing that I do, a lot of times I can tell whether or not it's likely temporary and going to get better on its own, or if it's been there for a long time and not going to change. In very rare instance will I actually prescribe something on the first visit with a patient for that reason, because I want to make sure that it's not something that's changing over time. If it changes after I prescribe you glasses, boy, you're going to be angry with me that I prescribed you glasses and now you've got to get them changed a month later. So, it's kind of in your best interest. If you've got double vision and I prescribe you glasses, then we will actually wait. That'll be probably a month after I see you for the first time, or until it stops changing, basically.
How common is the use of medications in treating these eye diseases, and are there, sort of a double question. That's what they ask presidents. They like to ask them double questions, see if they forget part of it. That might give it. But are there medications that we use to treat other diseases in the body that are effective in treating eye disease, or are there special medicines for eyes, or a combination of both?
Well, I think what you're asking, are there medications that can bring on the symptoms of double vision or dryness and other types of eye problems? Yeah. And absolutely. Basically, it comes to mind that medications that cause fatigue can bring double vision out. Medications that are there's a whole host of yeah. I could go through a whole bunch of stuff, but yes, they can cause different vision problems too. Although some of the medications are very good for these patients and keeping them stable, like Plaquenil, for example. Okay. It's very rare to get a vision problem from Plaquenil, but it can happen, and that's something that we do check patients for. That's not related to double vision, but other items, yes.
But I would think that, having asked that question, are there medicines that, we don't have much time, but Are there medicines that are effective in treating double vision, or is that something more is done with the glasses and things like that?
There are no medicines that would treat it, actually.
Okay.
Glasses would be the treatment for it. Or surgery if that's necessary.
Surgery, okay. Is there anything that we can really do to prevent double vision?
Well, yes. Depending on the cause.
Okay.
If you have dry eyes that cause the double vision in each eye individually, then you treat the dryness. If you have diabetes, you keep your blood sugar at the most stable level that you can, and that will reduce your risk. Most of this stuff is really blood flow issues. Okay, so anything that you can do to increase your blood flow in your body and keep it as healthy as possible, you're going to reduce your risk of those things that happen as you age.
And in the care of seniors, since most seniors are on Medicare, every service that you provide, I think, is covered by Medicare, isn't it?
Well, yes, all the medical services that we provide are covered under Medicare. Medicare, the only thing that we do in our office that's not covered, well, I won't say the only thing, but one of the main things that we do is refraction for glasses. Okay.
They charge for that.
And you have to charge for it because it takes time to do the refraction.
Yeah.
But basically every other medical issue is covered under Medicare.
And for people under 65, if you have vision insurance, most likely the procedure would be covered under that.
Under vision insurance. And then if you have a medical issue, your medical insurance covers your medical problems if you have a commercial insurance. Okay. Yes.
We've talked about double vision, we've talked about prevention, we've talked about optical nerves, we've talked about what, you have 1 minute, what would you like to say that I didn't ask you about double vision? Is there any really good thing you might want to offer?
What is fascinating to me is the eyes are really controlled by the brain. You've got 12 main motor nerves in your brain, all right? 6 of those 12 have something to do with the eyes. Does that blow your mind that half of your nerves that control your body actually have something to do with your eyes?
It does.
Yeah. So.
And that's why I think as technology and medicine evolves and we advance, we're learning more about how different parts of the body affect other parts, right?
Yes, absolutely.
Okay. Thank you, Dr. Mandese, for being here. And I want to thank you, viewer, for watching today's episode of Focus on Seniors. If you have questions or comments, call radio station WMEL 1300 AM at 321-631-1300. For more information on senior care and resources, visit our website, helpingseniorsofbrevard.com. And I want to thank you for watching, and I hope you have learned something from the very, very first eye show we've ever done since I've been hosting all these television shows. And I want to thank you, Dr. Mendese, for being here. It's been a great pleasure to be with you.